Hello, everyone. My name is Walt Schoenborn from Aunt Minnie, Director of Digital Media here, and I'm proud to present Volpara Health. We have a great presentation ready for you. It is brought to you by Shakira Kolber. The title of this presentation is AI for Breast Center Quality Management. Learn about the role of AI in management breast center quality at Baptist Health's Christine E. Lynn Health and Wellness Institute. The center uses AI to automate quality metrics for every mammogram, identify performance trends, and personalize technologist training. Let me give you a brief bio on Shakira, if that's all right. Shakira is the director of the Lynn Womens Institute and Population Health at Boca Raton Regional Hospital. She graduated from Broward College with a degree in radiologic sciences in 2004 and later graduated with an MBA from Nova Southeastern University. Her research interests and publications are in the field of patient experience as it relates to women's health. Shakira, the floor is yours.
Oh, thank you so much, Walt. I appreciate it. Well, I'm very honored to be here today. There's so much that I want to share and can't pack it all in this seminar. So I look forward to any questions at the end of our chat here. So I wanted to tell you a little bit about the Lynn Womens Institute, who we are and what we do, and maybe that'll make a little bit more sense about why we do it. So we are a facility in Palm Beach, Florida. We are Boca Raton Regional Hospital. However, we're a Baptist Health South Florida entity. At our set of centers, we focus on women's health. And in fact, prior to COVID, and anytime I refer to kind of practices and volumes, it's always going to be pre-COVID. So we look at kind of that year of 2019. So in the year of 2019, we completed about 120,000 procedures on about 60,000 patients. And I'm proud to say that this year is our 30th anniversary in our community. I haven't been here that whole time, but Dr. Schilling, our medical director, has been and has really been a pioneer for women's health. In addition to the breast services that we provide here, we have a full imaging center plus an array of clinical services, including oncologic breast surgery, urogynecology, preventive cardiology, and primary care. Truly, as you can see from our volumes, we are a very busy center with a network of centers just a little north and south of where we are. We call our center the mothership. At our center here, our busiest centers, we perform about 35,000 mammograms a year, 13,000 breast ultrasounds, perform 4,000 special procedures, and that encompasses both biopsy and pre-surgical procedures. And in the year of 2019, we diagnosed about 600 breast cancers. And we do all of that at 3 sites. This again is our mothership. We have 2 sites north and south of us, smaller, and they are performing the mammograms and breast ultrasounds. We also have a mobile mammo van that goes out to the community that just does screening mammograms, but quite busy. We do that with 9 breast radiologists, all dedicated to breast, and 30 technologists across all of our sites. Our focus has been and will continue to always be on personalizing healthcare for women in our community. But what makes us special? Why are we able to do what we do and serve who we serve? Well, we're very, very unique for a few reasons. First of all patients who come in for their mammogram and breast ultrasound, they receive their results while they wait. And if there's an abnormality seen on mammo or ultrasound, we'll do the additional imaging that day. And should there be an abnormal finding that requires a biopsy, the radiologist will meet with that patient along with a navigator who essentially then is her case manager from that moment on through diagnosis. And if warranted, if it is positive, then takes her into treatment and hands her off to our Cancer Institute. We also have something called the Know Before You Go, which is I have a little snapshot of that before. And what that really is what we call the women's health trifecta. So yes, you're coming in for a screening mammogram or for a mammogram, but you're in that mindset of wellness, of screening. You want to find something as early as possible so that the outcomes are better should there be an abnormality. So we think about that from the disease process and look at it from the whole woman. So what are the top 3 diseases that will kill a woman? Truthfully, we have breast disease, which we know, but number 1 is cardiovascular disease, and number 2 is lung disease. So breast disease, we've got down. We manage that every single day. And at the commencement of an examination, the patient is given this flyer. And in the 2 circles in the middle panel, that's information we give them on what their National Cancer Institute, NCI Institute's lifetime risk is for breast cancer. So we tell them what their risk is. We tell them what their breast density is. And then we tell them based on those items, what our follow-up recommendations are for their screening. Then in a section towards the middle where we look at heart health, if there is an observation of arterial calcifications in the breast, we notate that as an incidental finding, and we let our patients know that we did observe them. Nothing to be concerned about from a breast cancer perspective, but it is an indicator that they're at increased risk for heart disease, and they should follow up with their physician accordingly. And then at the very last column, if during our interview process, during our questions, it was shared that the patient is currently a smoker or has a history of smoking, we recommend that they be seen in our lung cancer screening clinic. So we are able to do all of this in our centers and really focus on the whole woman. And we do that in a 30-minute appointment time slot. So many people ask us, why? Why do you take on all that? You started 30 years ago in the field of breast imaging and mammography. Why isn't that good enough for you? Well, that's because my answer is why not? Instead of the why, but why not? There is the theory of what is a true breast cancer screening? What does that look like? And again, we look at the whole woman, and then we decide to take the information we already have or have access to, and what can we do to give women a healthier lifestyle? And again, we do all that with the end goal of saving lives. And I showcase here the Volpara there in brackets because we're using their AI platforms to facilitate all of this, to facilitate the ability to easily have access to what a woman's true breast density is for risk modeling, and then for quality and ACR, the ACR things that we have to do every 3 years. And then again, we use all of that together to then decide from a recommendation algorithm on what is the best screening guideline for that woman based on those items. And we leverage all of the array of products that Volpara gives us to be able to accomplish this. But then I guess we get to the how. So needless to say, we needed to establish a workflow that meets all of these needs of what we're trying to accomplish in a very small time window, but it has to be something that we could do consistently, and it was reproducible across all of our sites with all of our techs and all of our radiologists. It had to be something that was easily tracked and trended so we could look at what our outcomes were, measure them, and then have tools to quickly pivot if we weren't meeting those goals. We needed to ensure that we had quality that was consistent across our enterprise so that we were providing quality care all the time. And that really helped us and continues to help us build trust with our referring providers so that when we do recommend additional screening tools or additional imaging, they know it comes from the right place. It also helps to facilitate the buy-in for our radiologists and our staff. And most important, we need our staff to be all in. They have to understand, agree, and completely envelop what our mission is in order for this all to work. So all these things have to work together to allow us to do what we do. But then again, there comes the how do we do it? So I like to use the magic wand theory. Someone once asked me, so if you could create anything, what would that be? And I said, well, if I had a magic wand, here's my list. I would want products that were integrated and web-based, that had reproducible results, that were vendor neutral. That was important to me because in the beginning of our journey, many years ago, we had multiple different types of gantries and systems for mammography, so it had to be vendor neutral. The imaging metrics need to be automated. We lived previously in a world where everything was manual, lots of spreadsheets, lots of time was taken to be able to determine quality, positioning, were we meeting compression, what dose was. to look at our room utilization and productivity. And then how did we deliver those results to our radiologists, to our technologists, to our leaders, as well as how did we deliver what we were doing to our MQSA inspectors to meet, equip, and be able to, again, when it's time every 3 years to do ACR, how do we cut back the time that it was taking a human being to have to sit through and sift through hundreds and hundreds of images to find those that were considered perfect. So if I got to wave a magic wand, these are all the things that I would have created for myself many years ago. So we'll dive into the workflow a little bit. In focusing on consistency and continuity, it was really important that we had a way to individualize how we recommended care and what that looked like. So we leveraged at what Volpara could provide to us in the beginning of our journey with Volpara, which was about 8 years ago. So density was very important. We knew and continue to know, and the research shows that mammography does not do a good job of finding cancers for women who have dense breasts. So we wanted to start an ultrasound screening program for women who were dense, but there was no tool to be able to tell us truly what density is objectively. It was really up to the user, it was up to the radiologists. And that caused a lot of variability, and it caused us to lose some trust with our ordering physicians, where they would say, so this year she's dense, last year she was fatty, you guys have to figure out what's going on. I don't know what to recommend. You're making my jobs harder. So when Volpara came out with their density algorithm and we started utilizing it, we saw that trust rebuild. We saw consistency in our volume and our productivity, and we really were able to build a robust ultrasound screening program, such that now we saw a 75% increase in our screening breast ultrasounds once we started using this. So the proof right there is in the pudding, I shall say. Then we utilized Volpara's Aspen Breast software programming for our intake. So the technologists utilize this when they meet with the patient, they get their history, they enter it directly into this system, and then it spits out, if you will, a woman's risk. So whether you use Teracusic, NCI, Gale models, all these different models are all embedded within the Volpara Aspen product. So if a woman is at high risk, we can see that, the radiologists see that as soon as they launch the exam, in addition to what her breast density is. It's all there at the click of their mouse, and then they can make those recommendations. Does she meet the recommendations for high risk screening with MRI, or is she at a intermediate or low risk, but she's dense, so she should have supplemental breast ultrasound. All of this artificial intelligence truly allows that personalized screening environment to flourish. But quality is king. We can have all the processes and all the consistency, but if the quality of the imaging is poor, it means nothing. It's useless. So we needed to find a way where we could fairly evaluate quality from the technologist perspective. So prior to utilizing Volpara for that, it was when it was time to evaluate the technologist, you go in with the radiologist and you would say, okay, how's Sally doing? How's Adela doing? How's Amanda doing? And you would get their subjective feedback on what they could be doing better. When Volpara released their enterprise program and their analytics, I was able to now take that subjectivity out of it, and it was completely objective. I could dive right into objective analytics in real time to analyze technologist quality. But how is quality measured? That's really, really important, because truthfully, nothing can be subjective. It all needed to be objective. So we use their AI for image quality assessment. They have applied an algorithm to the raw images that come from our gantries to look at positioning quality and target compression, or to determine if the technologist is meeting target compression. So from positioning quality perspective, the algorithm is using ACR characteristics of what quality images should look like. And it is looking for those characteristic and attributes in the images, and then essentially grading the images based on a scorecard. For compression, our gantry is able to populate an amount of force that is applied to the breast when it's in contact with the paddle, taking into account breast size, because that is very important. And then it has an algorithm to determine if the technologist is meeting that target compression, or are they over compressing or under compressing. These two things are very, very important. From the positioning perspective, this is what I see as a leader. When I log in and I want to look at positioning and I want to look at metrics, I can log in and quickly at a glance see what's going on. So what you see in front of you is a snapshot of data for the last month. And what this looks like is at all my techs across all sites, how are they falling in within what I call the Volpara report card? The PGMI assessment is what Volpara calls it. And PGMI simply stands for perfect, good, moderate, or inadequate. So utilizing that algorithm to go in, utilizing deep learning and to recognize the attributes of an image, it can grade each image and then the aggregate exam utilizing the PGMI score. I, as a leader, can log in at any time and look at these scores. And if you look at the screen, you can see I really focus on the perfects and the goods. That's where I want the text to be as often as they can be. And then I look just below that and say, okay, I look at the stars. The stars tell me where we need to work on. It looks to me in the last 30 days that my technologists need to work a little bit more on their concave pec shape in their MLOs. So just at a quick glance, if I want to see how we're doing, I can take a look right here and I know what we're doing and how we're doing. I'll be very fair that when you see inadequates, one would assume there should be 0, but that is not the case. So it's important always that we share with our technologists that there are never going to be 0 inadequates, because if you have to tile large breasts, if there's any breast distortion following a surgery, if patients have limited range of motion in their shoulders, it's not going to be, some of the images are going to look inadequate, and we expect that. We absolutely do. But nonetheless, looking at this at a glance, I can see really quickly where we're struggling and what we can focus on. We can do a deeper dive as well. So if we did notice that there's a technologist who's struggling, we can do a deep dive into their images, into each exam they've done. And when we see exams that could use a little TLC or technologists that need a little guidance, we then pull this up. This is just, it's very granular. You see an overall aggregate and you can really get down to the granular level. But here's just an example. Here we review a case with a technologist. You see the list of criteria and you can determine real easily if it was met or not met. And the areas where you see the stars, that technologist did not meet the criteria in those areas. But they get to see that alongside the images in real time so that they can correlate what they need to do better to what it looks like. This tool is exceptional from a learning perspective for technologists, because just providing them data and numbers isn't meaningful, but being able to apply the data and numbers to what they can see and feel and touch really allows them that sense of ownership. Then we get into compression. All of our patients are so afraid of this, but when done right, it's worthwhile. So the biggest concern with compression is the pain, certainly, and that tends to be that you're over compressing. Well, how did we know we were or were not before? It really was tactile. The way that technologists were trained was when the breast feels taut, you've compressed enough, and if the patient's not grimacing, compress a little more. Well, that's not science. But Volpara is science. So utilizing their, again, artificial intelligence to look at compression, we can determine when and how often our technologists are in that target compression range. And again, that target compression or compression is analyzed by the equipment determining the force that was derived when the patient's breast was in contact with that paddle. And there's three areas for compression here. There's either high compression, target compression, and low compression, and all based on a very an optimized algorithm that Volpara was able to determine what that sweet spot was to optimize clinical performance but minimize patient discomfort. So here's, again, under the summary, this is a snapshot of what I look at. I log in, I see that 65% of the time in the last month we were in target compression, 27% of the time we were in low, we were under compressing, 8% of the time we're high over compressing. That's where the pain comes in. And that's where I tend to like to focus some of our energies, especially when you look at the graph just next to that where it's summary by breast size. Across the bottom is from a smaller breast up to a larger breast. And as you can see, we tend to over compress in the small breasts, and we really have to do better because those are the patients that really do suffer from that deep, deep pain. And those are the ones that aren't going to come back if they have a bad experience. So we look at this, we recognize the importance of compression, not just from just the high compression causing pain, but also under compressing increases dose and degrades image quality. So all those things have to be considered. But again, realistically, there are going to be instances where we do undercompress, and there are many reasons for that. But one has to do with implants. So if you aren't, there are ways to filter those things out. But if you don't filter, and you're looking at all of the mammograms that are performed, those do include patients who have implants, and this does. I had not filtered it out here. Therefore, you're going to undercompress because you don't fully compress, you only immobilize in those instances. So again, what that really comes down to is you recognize that there are no absolutes. Everything is within a range. For my leaders, it's important that they look at the quality metrics, and I call it the pulse checker at a glance. So what you see in front of you is a dashboard that I expect my leaders to log into once a week as a pulse check to see what's going on, just to make sure we are completely where we need to be. So if you look at where you see number 1, that's the percentage of good and perfect images over the time span. This happens to be the last month, but you can span it for any time frame you prefer. I look at that and I coin that my stocks. I always want my stocks to be equal or going up. I never want to see my stocks going down. So if I start to see that trend line decreasing, I call my leads and say, my stocks are going down, and they know they better log in and see what's going on. But as you can see here, it's pretty consistent, which I'm very, very happy with. Then number 2 is the compression. As I showed you before, at a glance, you can check very quickly. Where are we? Are we doing better or worse? In this last 30 days, we went up 5% in overcompressing and went up 1% in under. So have a little bit of work to do there. And then 3, which is one of my favorites, all those little dots indicate the different technologists. And this is a combination of both target compression and the percentage of good and perfect images. And in this graph, we want all the employees to be in the upper outer quadrant. That's the highest level of quality where we can be. And that purple diamond you see in the middle of it, that's the 90th percentile in the nation. So I'm really proud of where my team is, but as you can see, I have an outlier. So in real time, I can hover over that outlier. It tells me who it is, and then I can click on it to get more of that granular information. In this instance, that happens to be one of our newer technologists, and I know she's working her way into doing better. But for a new grad, I think she's doing pretty darn good. What really excited me is about a year ago, Volpara released an automated summary. So I didn't have to do so much of that granular digging. They do it for us. So once a month, the QA tech and the lead and myself get this quality summary. And it's a monthly aggregate that showcases all of our technologists' work. And it tells us who our top performers are, who is most improved, and what our progress looks like over that time frame. And what's really great too is it gives us a tip for focus. So at the very bottom, if it tells you where in that month the lowest kind of averages were, so that our lead technologists and QA tech know over the next 30 days, this is what we're going to work on. This is really, really great information that we share with our staff so they are engaged and they can see the product of their hard work. Then every quarter, we get a quality summary for the last 3 months. So although it looks pretty similar to what the monthly is, what makes this important is it trends. So if you have a technologist who had a few bad cases, was off several days, whatever the case might be, that 1 month might not look great, but 3 months really do tell the tale. So here you go. This really allows us to trend who our top performers are for the quality scores, in addition to positioning and compression. We share this. We want them to be engaged. And again, at the very bottom, it talks about how do you improve your quality? What are our focuses? And hopefully, we've been working on those for the months prior. But this is very, very well received by the team. Then as an administrator, I use Volpara's AI tools because it helps me to really manage productivity and staffing across all of my centers. So here's one screen that I use often, and it is the number of studies performed. So this was about a week's time, and we were looking at the 4 different sites that we have. I can take a quick look and see how many exams are we doing. I can look at it compared to my staffing to determine, am I overstaffed or understaffed? It allows me to look at it again by the entity, by the site, by the different rooms, and I can even, again, go into the granular level and see which technologists are in each room. This really, really does allow us to manage staffing better, to look at our workflow, and incredibly, it actually helped with equipment replacement justification. If you look in the upper little room that's labeled DWC, that's our Deerfield Women's Center. There is one room that is used twice as often as the other. And that is because that other room it's suffered downtime. It is our oldest unit and really is due for replacement. So I was able to use this information as part of my justification. I also use this from a productivity perspective. So again, that granular level, I am able to look at an estimate of the time per case. So Volpara Analytics tells me from first exposure to last exposure, how much time are the techs in the room? Also lets me see who's working a little too fast or a little too slow, because either ends of that average typically relates to quality. It really also helps to modify time slots in case there's a question of whether or not you can increase your capacity. Certainly now with COVID, we don't want to increase capacity too much because we do need to allow time for cleaning and sanitizing in between patients, and it does take much more time. But I'll share with you prior to COVID, and when actually much prior, way prior to COVID, when I had first started here at the Center for Breast Care, and I was relatively new, all of our time slots were 30 minutes. And I thought, well, that seems like a lot of time, but the technologist assured me they must have that 30 minutes for every single patient. Well, follow up about a year later when Volpara started providing these analytics, and I said, on average, it's like 6.5 minutes in a room. I'm going to double that because there is time for the intake, there is time for cleaning, there is time that a technologist has to spend with the patient. So even if I doubled that, that's still about 13 minutes. We don't need a 30-minute time slot for that. So we're going to go ahead and modify that. And I essentially made every screening mammogram a 15-minute slot, but I kept the diagnostics to 30 because those tend to take a little bit more time when it's a difficult case. So I was able to increase my capacity per room by 20% when I was able to utilize this information. So I'm often asked, so how do your techs feel about this? Do they think it's Big Brother? Well, I have to tell you, cooperation and buy-in is key, but it is instilled from the get-go. We discuss the importance of quality and metrics at the time of hiring and training. We start tracking them 30 days after start, and we set that expectation in the very beginning right away. It should never be a surprise. And then they'll see a lot of this quality tracking again at their 90-day and annual evaluation. They also have the opportunity to, as every technologist does, they can log in to their own dashboard and do their own weekly pulse checks, do their own monthly deep dives. It is not just myself as the administrator or my leader QA tech who is responsible for quality. It is the employee's responsibility. But what I really share with them often, if they get a little bit frustrated, is improvement takes a lifetime. If you tell me today that you are the best that you're ever going to be, then I have to tell you, you might as well die tomorrow. It's horrible to say, but it's true because we all have room for improvement. So why not take this robust tool and utilize it to the best of our ability and be better? Because wouldn't we want that for ourselves, for our mothers, for our loved ones? And once you put it that way, there's no more discourse. They really understand it. And they really learn to embrace it. It's not meant to be punitive. It's really meant to bring in all of the knowledge that we've learned from the years to just do better. And it's all about collaborative quality with our radiologists, with our technologists, with our patients. But what it really allows us to do is, rather than just, again, sending them the scorecard with 27 metrics and saying, here are the things you have to work on, it allows us to focus on one thing at a time. And that's very tangible. That's very easy to do. And when you focus on one thing at a time, you can watch how that trends in terms of improvement. It also allows us to provide true recognition and positive reinforcement. The picture you see on the side are technologists who had perfect images for that week. So we print it out and we showcase it for all to see because they should be very proud of that. And what that really helps to do is reinforce how proud we are of them and how important quality is. But it also allows the technologists who are struggling a little bit to see who's excelling so that they can take it upon themselves to go to that technologist and ask for help. You know, if they're really struggling in one area and you see that your fellow technologist does well there, ask her for help, shadow her. It's a team environment. It's all about collaboration. But I want to share with you a little bit about the power of training. So again, using Volpara Analytics, we had started getting all of our information and sharing it with the cloud, if you will. But I didn't tell the technologist at first. We just wanted the information to flow in so we could establish a benchmark. So we looked at, if you look at the before, each one of those dots were various technologists, and they were all over the place. And they were all over, and there was no rhyme or reason, whether it was, you know, you've been doing this for 10 months, 10 years, 20 years. They were all over the place. And it really came down to the fact that there is no consistency in training. Yet there was, and we didn't realize that. So after doing some Google searching, the wee hours of the morning when things like this keep me up, we found a woman by the name of Louise Miller who taught something called the Miller Method. And it really was just standardized approach to mammography positioning. And we got the okay from administration by showing them where we were, again, utilizing the power of AI to showcase what our needs were. Showed this to our administrator and said, we really need to bring somebody in. We're better than this, but we just don't know how to get there. They agreed. We did the training, and then 90 days later, we reran that information. As you can see in the after, all of this text came together. All of their quality became more consistent. And even more so, if you look to the graph on the right, the overall positioning pre and post training. So everything below that line was improvement after training. And that just speaks to the power of standardization and how important it is for us now, as it was 2 years ago, 3 years ago when we started that, to continue to train, to have super users. And frankly, if I ever do see that the quality is starting to go down and even my super users aren't able to elevate, we bring in Louise again and her team, and we do refresher training. But I will share with you something. Within the Volpara tool for the technologists, when they log in and they look at their scorecard and they see where their opportunities lie, there are embedded videos for them to be able to watch. So you don't necessarily have to bring in a trainer, but you can set the expectation that if they're struggling in any one area, you expect them to spend that time to go in, watch the videos, their tips and tricks, they're super fast and easy to follow, and then to use those on their next patient and see how they're doing. It feels awkward at first because there's muscle memory, but I assure you, if you follow that method, your quality will go up. And as you can see from this, we trended our outcomes. So over the last 45 months, you can see where we started and how we continue to elevate. And that orange line in the top, that's where the top 10% of Volpara users lie from a quality score perspective. There's lots of up and downs, as there always are. Just by being human beings, we tend to get complacent. And we had a lot of staff changes. We have people that went on to do other modalities that moved. So every time you bring in a new technologist, your scores do go down a little bit in the beginning. But what was important is not that one moment in time, but how are we doing over time? And as you can see, training is powerful. But I could not have recognized the need for that if I didn't have the tools at my disposal that were easy to track and trend, as opposed to the manual process and the subjective process that we did previously. But the proof is in the pudding, and here's our pudding. So not just looking at overall quality, but let's look at the National Mammography Database which is a benchmarking tool used by the American College of Radiology. So in this instance, we call it the NMD. As you can see from 2019, the blue dotted line represents our institution. So our recall rates consistently go down. Our PPV3 is significantly higher than the national average. And that is very important. PPV3 is the percentage of biopsies that result in a cancer. The national average is about 25%, but we hover close to 50. And again, that comes down to having all of these tools at our disposal. It is having quality technologists, it is having that training, it is being able to appropriately screen our patients by having these tools to be able to determine what the right thing is for those patients. The bottom two, the minimal cancer and the early cancer detection rates, those speak a lot to our quality as well. We are finding cancers when they are small, non-invasive, and easy to treat. So we maximize what Volpara gives us to exceed the national quality goals and remain consistent in our product. So in summary, how do we use Volpara's AI platform as our toolbox? We use it to personalize our breast cancer screening, to utilize the risk assessments and the standardization of the density metrics to really be able to tell patients one-on-one what's right for them. Through Volpara Analytics and their enterprise program, we can track and trend our key metrics, including image quality, workflow, and dose management. We are able to keep the staff actively involved in quality care that they provide, and they can see the change. Them being able to log in on their own in an unbiased, comfortable fashion and be able to see how great they're doing, or maybe where their opportunities lie, gives us that buy-in, and it really is their fuel to want to do better. And finally, and this is really important to those who manage the MQSA inspections, the equipment metrics that we have to meet, as well as ACR case identification. Having this tool that identifies key elements to quality images really reduces the rigors of the MQSA inspection, and it streamlines the perfect case identification for when we have to submit to the American College of Radiology. And that concludes my presentation.
And an awesome presentation it was. Thanks, Shakira. That was really great. Some fantastic insights, and I know that everyone was very appreciative of it that is in attendance today. And a brief or quick reminder to go to the expo portion of our virtual conference event. You'll see that in the left margin of the Hop-in toolbar. Please visit the Volpara Health booth. There's a lot of great content there and can answer a lot of questions. And speaking of questions, we're going to roll right into it. We had a lot of them come in during your presentation. So I'm going to go ahead and get started, if that's all right with you.
Great.
First one came in. Your center recently became part of Baptist Health. How does the system approach quality? And do all sites doing breast imaging use this AI platform?
Very good question. So we were the last of the hospitals to come aboard with Baptist, and being an independent hospital for many years, we did have some of the autonomy to have these types of programs. So we are the first in Baptist to have it. I will tell you that. But as soon as my counterparts at the other facilities came and learned about it, they quickly jumped on board and it put it into their capital budget to request to have the same thing. They are just as passionate as we are, but struggled with the depth of finding out how to do it. And once they saw this, they were bought in.
Awesome. Awesome. And it's great to hear that they're kind of all in on this. So that's fantastic. A question for you directly. How often are you personally in the AI software reviewing the data and trends and including your staff?
Myself, I am in probably once a day, and I just do that quick screen. I just want to make sure everyone's behaving, and I got to check my stocks.
Yeah, there you go.
The technologist login, my expectation is once a week. Some people, maybe once every 2 weeks. I have some that I've had to ratchet back and say, you're going to drive yourself crazy, just once a week. My leaders, it's probably once every other day with an expectation of what they're meeting at least once a week, where they block out their schedule, they sit in their office, and they really sit down to look at this.
Awesome. And then the next question that actually came in refers to that a little bit. Are your radiologists aware of your efforts with the technologists and how you are using AI to improve quality? What has their feedback been?
Oh, we are so blessed to have the radiologists that we have. They are fully aware and completely engaged, and really, really embrace this. They're so happy to not have that onus of responsibility of having to determine if technologists were truly qualified or if the image quality was where it needed to be. In fact, there was one radiologist who would often send texts back in to compress a little more because she felt we were under compressing. And that just drove the technologists nuts. And for many other reasons, it wasn't the right thing to do. So I was able to showcase that, no, look at where we are. We're right where we need to be. And in fact, for the cases in question, I was able to pull it right out of that Volpara analytics and say, we were in target compression. There really is no need to go back and repeat. That was all she needed to have faith in the technologist, and that request for additional compression has since stopped.
Nice, good to hear. Question came in, do you socialize the data and improvements with other quality programs or committees in your health system?
That's a really good question. So in our health system as a whole within Baptist, we're still babies. We're new. So I've only shared it within the mammography leaders. I have showcased it there. Within my own hospital, once a year, each of the different institutes. So on the Women's Institute, there's a Cancer Institute, a Cardiovascular Institute, Neuroscience Institute, and so forth and so on. They each get time at the board meeting to talk about what they've done. And I share this information at those board meetings. And it really does, you just see how much they beam with pride when they not just look at what we've done and how we've done it, but look at our overall metrics and see how we benchmark across the US. Last time I got standing applause.
There you go.
Yeah.
So unfortunately we're up against it, but I've got two more questions for you if you've got the time.
Great.
So this question came in, you've been using this AI platform for a while now. Is your staff growing fatigued of it? How are you finding continuous improvement opportunities?
Absolutely. So with anything, the staff is fatigued. I mean, just COVID, we're all fatigued. So one of the images I shared with you was their scorecard we put up on their, to boast them. We put that up on their lockers so others could see, and that really helped to reinvigorate. But we will do challenges and say, okay, this month, let's see who can get the highest metrics in nipple and profile. And whoever does, we're going to give you a gift card. We'll do little things like that, fun little things. It always starts to die down. And you just have to see when the stocks start to go down, what do you have to do to reinvigorate the market? And you just get creative.
You got to watch those stocks constantly. So last question for you. Are you using whole breast automated ultrasound scanners or manual screening scans for dense points?
We use handheld ultrasound because of our workflow here, where if we see an abnormality, we're going to do additional imaging and work it up. The automated breast ultrasound just didn't meet with our flow because it would have required you to scan the breast and then have a rad review it and then take them into a different room to rescan. So we are doing everything handheld, but our radiologists have a really defined algorithm and kind of defined workflow for the technologists in what they scan and how they scan. So assuming all is normal, it's not a highly cystic breast, the technologist can get through it in 20 to 25 minutes.
And I lied. I do have one more question for you.
Sure.
Russell came in with a late question. What are the predominant types of biopsies performed? Cytological core, SLNB, touch imprint.
80% of our biopsies are ultrasound guided core.
Gotcha. Shakira, thank you again. It was a great presentation. We all appreciated it. Again, everyone, please go visit Volpara Health over in the expo portion of the virtual conference. And Shakira, have a great day, and thanks again for everything.
My pleasure. Take care.
All right, bye-bye.